nurse practitioner. I get to study the brain and behavior. I'm interested in people and what we can learn from their experiences. Come explore the wonderful world of mental health with me. Welcome to my YouTube debut. This is the first video that I'm gonna be a part of, and I'm super excited to be here. So in this video, we're gonna be talking about depression. It is a dark, gloomy day. Hopefully the mic is not going to pick up too much of the thunder, but it's a dark, gloomy day, so I thought this would be a great time to talk about depression, what it is, what can cause it, and what we might be able to do about it if we're experiencing it. So, a little bit of a disclaimer, remember, I can't see you. I'm talking to you through this video, but I can't see you on the other end. So this is not medical advice. Talk with a doctor, talk with a healthcare provider about what's going on with you and what might be helpful. All right, so if you click this video, you're either one of my family members or closest friends, or you may be wondering if you might have depression. Colloquially, depression isn't much different than sadness. They're sort of used as terms, they're kind of used interchangeably. But medically, there are a number of different disease states and conditions that can cause depression. Some are due to vitamin deficiencies or hormonal imbalances. Others are due to mental illnesses, bipolar, major depressive disorder, schizoaffective, or just some of the mental health conditions that can include depression symptoms. So I can't speak to what is causing your particular symptoms, but I can explain sort of a broad overview of what depression is, and then we can discuss some things to consider, maybe some next steps. All right, I'm gonna give a long list here of some different symptoms, and I'm gonna kind of walk you through each one by one. Okay, so the first symptom I want to talk about is low mood. Low mood is a very common symptom of depression. A couple of things to remember with low mood, we're looking at an average, right? So if on average your mood is low, maybe lower than you expect it to be, lower than it used to be, then you could probably tick this box. Depression doesn't necessarily mean the absence of any happiness. Oftentimes people who experience depression do have moments of happiness, but on average, mood is low. The next bullet point, lack of interest or lack of enjoyment in life. If you feel like you're not enjoying things, if you feel like everyone around you is laughing and smiling and you're just not feeling it, then you may be experiencing lack of interest. Many people who are experiencing depression are able to look back at, at some point in the past, could be many years ago, could be many weeks ago, but they're able to look back on a time in the past and say, okay, I actually did enjoy some things. Maybe I enjoyed being around my friends or family. Maybe I enjoyed a particular activity, going on a roller coaster. Maybe there's something I really had fun with, and now I don't really feel that. Many people who are experiencing depression describe that in particular, where they say they just don't really feel anything. All of their emotions feel a bit more dulled. So if that's what you're experiencing, then you may be able to tick this box of lack of interest. The next one, changes in weight. People who are experiencing depression often have changes in their appetite. Sometimes people find themselves eating more, maybe much more than normal, maybe eating more mindlessly than they usually would. Other times people find they're just not interested in food. Maybe they're just not hungry, maybe food doesn't taste as good, it's not enjoyable. But in either case, whether you find yourself eating more than normal or less than normal, that can absolutely be dangerous. This could lead to a serious weight change that could be very serious if it lasts too long. The next one, sleep issues. So with sleep issues, sort of similar to appetite changes, some folks find themselves sleeping more than usual. Other people find themselves sleeping less than usual. Many people find themselves just exhausted but unable to sleep for more than a few hours at a time. So if you're either not sleeping or the sleep that you're getting isn't restorative and you feel like you need more and more and more of it, that may mean that you're having some sleep issues that you should talk to your doctor about. The next one is related to this as well. It's feeling tired or low energy. Depression causes basically a depression in energy. Most people who are experiencing depression feel kind of tired, sluggish, low energy, just getting up and doing anything, even what feels like a basic sort of day-to-day activity, can feel impossible. It can feel like you're just moving through mud. You just can't seem to get going. That could be could tick this box for feeling tired or that low energy. The next bullet point is feeling worthless. When people are depressed, they often get disconnected with themselves and disconnected from others. They may isolate, they may put themselves down. Everything that they look at can be sort of clouded with gray. It just looks more gray than it did before, than it does to the people around them, than it did to themselves in the past. Nothing looks as bright or as hopeful or as enjoyable as it once did. With this negative sort of slant on how they see the world, also comes a negative slant on how they see it themselves. Many people who are experiencing depression may feel like, I'm worthless, I don't matter, not worth anything. And, you know, I just want to make sure that I emphasize that this is not true. Depression tells you that you don't matter, and it's a lie. In the same way that, you know, at one point in your life when you're not depressed, you can enjoy an activity, maybe you can enjoy yourself. And then when you're depressed, that enjoyment can go away. That's the disease of depression. That's not you. The next bullet point is feeling excessive guilt. So kind of connected to some of the lies that depression tells you. Depression also often tells you that everything is your fault. Maybe you feel guilty about anything and everything you do. The guilt that I'm talking about here is not the sort of helpful guilt, perhaps, that kind of motivates us to make some change in our behavior. You know, the type of guilt that you feel you forgot to call your grandmother on her birthday and you feel some guilt about it, right? She's not going to be around forever. You feel bad you didn't call. That guilt, that sort of discomfort could push you to pick up the phone and call her and check in and say, happy belated birthday. That guilt is productive. It leads us to make some positive change. The guilt, the sort of excessive guilt that often comes with depression, is not productive. It's guilt over doing the dishes or not doing the dishes. It's guilt over saying something wrong. It's guilt over, you know, I didn't do enough for my children. I didn't do enough for my partner. It's guilt that's not, there's no solution to it, right? If you feel guilt for existing, there's no productive resolution to that. It's not helpful. That's, again, the disease of depression. This is what it does. It puts guilt on you. It says that things are your fault when they're absolutely not. The next bullet point I want to talk about is feeling like you can't concentrate. So many people who experience depression find it difficult to think clearly when they're in the thick of it. Again, in the same way with movement, it's like you're moving through mud. It can be hard to move your physical body around. And it's the same thing with your thought process. A lot of times when people are down and depressed, it's hard to think clearly. It's like their thoughts are just sort of getting stuck. It's hard to think something through. It's hard to think through who they are, what they want their futures to look like. You know, that's a part of the way that depression can be so damaging, is in a way it can make it so difficult to think that you can't see your future clearly. And if you can't see your future and you're just stuck in the mud, that can be a super dangerous place to be. Connected to the, you know, dangerous kind of thought process or thought process that can happen with depression, of feeling like you can't concentrate or think clearly, you're kind of in a fog, comes, you know, what I think is probably the most dangerous symptom of depression, and that's thoughts of death or dying. That could look like feeling like you don't want to exist, feeling like you're okay with something bad happening to you, all the way to thinking out ways and means to hurt yourself. If this is something you're experiencing, Do not pass go, do not collect $200. Call 911, call 988, the crisis line. They're super helpful, and get the support that you need. Your life is worth it. Even if you're not totally sure right now, it's worth it. Call. So some of the bullet points we reviewed may be familiar to you, some may not be. You don't have to experience all of the symptoms I listed to have depression or be diagnosed with a depressive or mood disorder. So I want to address, so maybe you're looking at this list and you're thinking, well, yeah, I kind of experienced some of those, but it's not that bad, right? It's not that big of a deal. And I think this is a really common problem. A lot of people look at their lives and look at their symptoms and feel like, well, I'm not crazy. My symptoms aren't bad enough to seek help or seek support. And it's just not true. There's a reason that you sought out this video, right? There's a reason that you're at home in bed Googling on your phone how to deal with depression, or what's going on with me, or what's wrong with me. Right? There's a reason that you're here. Many people get in the trap of feeling like their symptoms aren't bad enough. But if you sought out this video because you were feeling depressed, I think we can reasonably say that your symptoms are bad enough to rationalize getting some help, getting some support, getting out of it. Maybe this is the 10th depression video that you've watched. Maybe you're watching TikTok videos about mental health. Maybe you're Googling, could I be depressed? Or what does depression look like? Maybe you've done this 10 times. If you need somebody to tell you that you can get help, I will say it. Go on and get some help. It is worth your time. Depression is not a competition. There are people whose depression symptoms are going to be more severe than yours. There are people whose depression symptoms are less severe, and everyone's experience is valid. I just want to say that outright. Whether your symptoms feel severe or not doesn't matter. It's probably hard for you to judge that anyways because of the depression kind of clouding your perspective. So reach out, talk to somebody. Getting properly diagnosed and getting the right treatment is important. But regardless of what your diagnosis is or isn't, your feelings are valid and you deserve help. Check out my other videos coming up on depression. Talk with your nurse practitioner, medical provider, doctor about what's going on with you so you guys can find the right treatment. Thank you for watching my video. Great to meet you guys all on YouTube, and hope to see you soon. Bye.